As we said, it is the first official day of summer all day, but this also might be the summer of Zika. We got some slides coming up to get you a little bit more knowledgeable about it. So Zika 101. First of all, you can get Zika only from a certain kind of mosquito as the source that starts off the whole thing. Or you can also get it from having sex with a man who's infected with the virus, as men carry it in their semen apparently. Symptoms include fever and rash, and most people who do get the virus aren't really aware of it because some don't present with symptoms. But it has been linked to very scary and severe birth defects. So going on, Zika in the U.S. U.S. officials have warned pregnant women not to travel to Latin America and the Caribbean, and women who are considering getting pregnant or around childbearing age should really be conscious of traveling to those places. There are about 234 pregnant women in the U.S. who've already been diagnosed with the virus, and 3 babies have been born in the U.S. with birth defects that could be linked to Zika. So, looking at Zika right here in New York City, there are 151 reported cases of the virus. 9 of the 151 were with women who were pregnant at the time of their diagnosis, and all of them had contracted Zika while visiting other countries, and all of those patients have recovered. So that's a little look at what may very well be the summer of Zika. Now let's get into the A block.
While Congress dithers over how to deal with the Zika challenge, New York has already launched Fight Back NYC, a citywide campaign to inform citizens about how they can reduce and avoid mosquito bites and learn more about Zika and other mosquito bite viruses. To answer some of the questions that New Yorkers may have about the disease, we want to welcome to BK Live Dr. Torian Easterling, Assistant Commissioner for the Brooklyn District Public Health Office. Welcome, Torian. Thank you so much for joining us.
Thank you for having me.
So, as we just said, New York is preparing. We're getting more ready than Congress is, apparently, and we'll get into that. But summer for us is travel season, and a lot of New Yorkers are planning on traveling to Zika-affected countries. So, what's your biggest concern there?
Yeah. We're a global city, and you're right. A lot of people are going to be traveling to Latin America, to the Caribbean.
It's where we're all from.
Right. That's right. And so, the main concern that we have is the pregnant mothers. And that's the real concern. As you mentioned, there have been associated with birth defects that the Zika virus has. And so we want to be diligent in testing mothers, making sure that we're providing management and care for mothers, that they know, what they need to do if they do contract the Zika virus. But layered with that is also understanding that, we understand that a lot of the, residents who are coming from the Caribbean, Latin America, they're uninsured. This is the immigrant population. And so we want to make sure that they have the access to the care that they need.
So Dr. Easterling, when people were coming back from like Ebola-affected countries, when that was the big thing, you could sort of screen them, like if they had a fever, where have you been, those sort of things. Are there any checks that can happen sort of at border points for Zika?
No, it's quite different, and the testing is more specific, making sure that we do a blood sample. We also do urine sample. But the other issue with Zika virus is that there's a lot of similarities with other viruses, dengue, West Nile, yellow fever. And so we really need to do specific testing to ensure that, one, this person does have Zika virus, and that we are providing the right management. And so, to the point of, how do we really test? That's why we are ensuring that we're providing healthcare providers with the right information.
Right. I mean, so it sounds like maybe just everyone should get tested who comes back or gets bit by a mosquito, but that sounds like that really isn't sustainable or doable.
Yeah. No, I think, and you already provided the right information, right? Most people do not know. 1 out of 5 actually develop symptoms. 80% of people do not even know that they have the virus.
So, doctor, what is that like then? If you do develop symptoms, I think it's just like the 2-day flu kind of thing? Is it enough to knock you on your butt for a day and then you just keep going? Or is it like serial?
Yeah, so it varies, and most of the symptoms, they resolve on its own. There's no treatment that most folks have to take. As you shared, fever, a rash. Some people may develop red eyes, but not something that's so severe that someone is incapacitated. But these symptoms resolve on its own.
So I have a question then. If you like to get into the for real of it, so I'm in Rio. It's Olympics time, and then I come back. And I have a date, whatever, with a person who's of childbearing age.
Right.
How long from the time I got bitten by the mosquito to the time when we can do it without a condom?
Right. Great question. And so you're absolutely right. As you shared, this is a primarily mosquito-borne disease, but there are rare cases where this is sexually transmitted, and sexual contact is of concern. And so if there is a male partner who is coming back from a country where there's ongoing Zika transmission, then they should use condoms, whether it's any type of forms of sex, during the time of pregnancy and 6 weeks after. And so they should continue to use condoms during that period of time.
So from the bite to the getting it on, it's a 6-week window of where you should be using some kind
Well,
of...
for the entire duration of the pregnancy and beyond.
Well, what if you're not pregnant?
Right.
Like I'm saying, if you just have a good Tinder date, like after being away in Brazil, like how long should you wait? Because you should be using condoms anyway.
Right.
Pero if
Sure.
you don't, what's the window?
Yeah, so then it's 2 weeks.
Okay.
If they're not pregnant, then it's a 2-week window. Then they
Gotcha.
should be using condoms after returning.
But it might be a different period if you've shown symptoms, right? So if you actually have symptoms, does that increase?
Well, and so there's a lot that we're learning, and
Okay.
so we probably need to learn more, see more studies. So not sure if the risk of actually transmitting the virus is any higher for the person to contract Zika virus. So there's more studies that need to know. I mean, just understand, the first outbreak of Zika virus is in 2007.
Okay.
And so we're learning
That
as
was
we
my
go.
next question.
Okay.
I'm like, I'm almost 30 years old, and I never heard of the Zika virus until 2 weeks
Right.
ago, kind of thing.
Yeah, that's right. I mean, much of what we know is from the outbreak in 2007, and that was in Micronesia. I mean, and so this is the first time that we're seeing it in the Americas.
Yeah.
It started south in Brazil and has come north. Now it's, seeing in the Caribbean
And it's happened with this specific mosquito, is that correct? So what's the mosquito? Did it first only exist in Brazil and then it traveled everywhere else, or it's been passed from that same type of mosquito to other countries? How does that work?
Right, and so what we know is that the mosquito that carries the Zika virus, the climate that is conducive for the mosquito is tropical climates, and so that's why we've seen it in countries that are particularly warmer. People are outdoors. Here we have never seen the mosquito that effectively carries the Zika virus, and that's the Aedes aegypti. That's the mosquito that we know effectively carries the Zika virus. But there is a family relative of the Zika virus here in New York, and that's the Aedes albopictus. And so, but the difference, so the Aedes aegypti.
They're like first cousins.
Yeah, exactly. Right.
Kissing cousins.
But what we need to be concerned and what's different about this mosquito is that they're aggressive day biters. They're out during the
so
day.
it's not at where we're used to the
evening
twilight.
time.
Right, where you
just hungry.
Exactly, right. And so when most of the message is try to stay indoors when the sun goes down, but these mosquitoes are out during the day. And so what we're now concerned about is the Aedes albopictus, because we know that they've been seen here in New York, but we do not know how effectively the Aedes albopictus carries the Zika virus.
So speaking of that messaging, though, the New York City Health Department and mental hygiene folks have made an aggressive campaign.
That's right.
So we can be aware. So what are the takeaway points that we should look at? I see 3 main bullets.
Sure, yeah. I think one, folks need to know that we're building on our 15-year history of really doing mosquito control programming. And so because of the work that we've done around West Nile, then we know how to really test and trap and really do surveillance around mosquitoes.
Yeah.
So we're really trying to do our part. We're asking that New Yorkers are doing their part to ensure that they're eliminating standing water.
Right.
What we know is that all you need is a soda cap size of water for these mosquitoes to breed.
A soda cap?
That's it. That's it.
So think
That's the
about
amount of
all
water.
those junky flower pots you have outside,
Yes.
the tires
The
that are
tires.
sitting in the
Dog
lot.
right.
water bowls
Yeah.
that you have outside,
So all of these are breeding grounds.
That's right.
That
That's
much water.
pool covers.
Right. So making sure. Now, if this is too large, then they should call 311 to really try to get some help to remove those standing waters.
Right.
The other part is making sure that you have insect repellent. Carry that throughout the summer. It is safe during pregnancy. It is safe for breastfeeding mothers. It is safe for toddlers. So making sure that you are using insect repellent.
So what's a good one that is safe for mothers that's not like DEET or poisonous? I know there's a lot of like from Skin So Soft, the Avon people, or the
Yes.
citronella is like, what is an actual effective one that a pregnant person or just someone who's concerned?
Or a child,
Without
putting it on a
poison.
child as well.
Right. I mean, and so the studies show, I mean, if it's EPA certified and has DEET, I mean, there's no particular brand that we're elevating, but we just know that the studies have shown that if it's EPA certified, then it is safe. It is safe.
Okay.
So if we're looking at risk then, we've heard of West Nile for a number of years
Sure.
now. Is that still a bigger risk? Like Zika's taking a lot of headlines and you see the compelling pictures of the kids born with defects. But are we right now, summer of 16, as it is more a threat from West Nile or from Zika?
Yeah, and so we wouldn't say that there's more of a risk for either. I mean, we have to do our work around both West Nile and then
same
also
cure.
Zika virus. There is no cure.
Well, I mean,
Right.
the same precautions
Yeah, absolutely.
can
That's
protect
right.
you from Zika or West Nile.
That's right, but I think it's different populations. So for West Nile, we're really trying to target to the elderly population.
Gotcha.
And then for Zika virus, we want to do more
Childbearing
around
age.
exactly childbearing age.
Is there work being done potentially on finding a cure or a vaccine?
I'm sure, you know, we know CDC and we know, you know, World Health Organization is really doing more studies have to be done to understand. And then also there's probably, you know, more studies around vaccines and trying to understand, you know, what's the possibility of having a vaccine. But we're really working around testing, you know, surveillance around mosquitoes and disseminating information.
All right,
Excellent.
last question, doctor. So if I get a mosquito bite, do I need to make an appointment? If my kids come in the house or they wake up the next morning with mosquito bites, do we need to go to a doctor?
So if you develop a mosquito bite, if you have any symptoms, so the fever, the rash, the red eyes, you know, if you have any body pains, you should talk to your provider, particularly if you traveled from a country where there's ongoing Zika transmission. But I think, you know, but the concern is if you are pregnant, whether you have symptoms or not, you should see your physician.
Okay, get tested. Thank you so much
Sure.
for sharing all of
Thank
this
you for
with us,
having me.
Doctor.